In this video, you will learn how to properly set up a patient and use the hand mentor. Proper seating and positioning are important when using the hand mentor. Seat the patient in a sturdy chair and position the computer monitor on a nearby table so that the emergency stop switch is within easy reach of the patient. The patient's hand should be resting over the edge of the table or on a foam pad. The air hose and data cable must be connected to the hand mentor and mentor controller. Insert the gray and black data cable connector into the data port on the hand mentor. This is the connector with the black ring. Be sure to push the connector straight in and pull straight out when the session is complete. Do not twist the connector. The white connector on the air hose is inserted into the white connector on the back of the hand mentor. If the connector does not easily fit into the port, press down on the silver tab to disengage the connector lock. This will sometimes be bumped when the mentor is not in use. Insert the air connector until you hear a click. Now you need to plug in the air hose and data cable to the appropriate connection points on the front of the mentor controller. Insert the gray and black data cable connector onto the data port of the hand mentor. This is the connector with the black ring. Be sure to push the connector straight in and pull straight out when the session is complete. Do not twist the connector. The white connector on the air hose is inserted into the white connector on the front of the controller. If the connector does not fit easily into the port, press up on the silver tab to disengage the connector lock. This will sometimes be bumped when the mentor is not in use. Insert the air connector until you hear a click. Now we will apply the hand mentor device to the patient's arm. First, remove the volar foam strap and undo the top finger straps. Flip open the finger cover and loosen the screws on the side of the handpiece so that the handpiece is open to its largest position. Bring the patient's fingers up through the opening and place each finger into a trough on the finger foam piece. The MP joints should be directly in line with the leading edge of the handpiece. It is important not to hyperextend the fingers. The thumb goes under the handpiece. Flip the finger shell closed on top of the fingers and firmly secure the finger straps to capture the patient's fingers. One thing to watch for is proper alignment of the side linkages. If the linkages are not aligned straight, they will bind and the patient will not be able to move their hand. Loosen the screws and make sure that the handpiece is adjusted to the same position on the left and right linkage. To properly adjust the size of the hand mentor, you must line up the axis of rotation of the patient's wrist with the axis of rotation of the hand mentor. If you could pass a pin through the middle of the circle on either side of the hand mentor's wrist axis, it would pass directly through the patient's flexion-extension wrist axis. When you have the right size, tighten both screws and apply the volar foam strap. The curved cutout of the strap should be positioned by the patient's wrist. The strap should be very snug, but not uncomfortable to the patient. Proper positioning and good posture are important for the patient. Make sure that the front tip of the linkages do not hit the table or any other obstruction. Make sure that the patient's shoulder is properly supported. If you tug on the proximal humerus, the patient's hand will tighten up and make the therapy session less productive. You are now ready to use the hand mentor. The various therapy programs are described in the other videos in this series.